Okay. Hi, everyone. Thank you for joining tonight in this very important program. I'm Beth Quinn, a member of WRJ Programs Committee. I'm also a co-first vice president of the Northeast District and co-president of my sisterhood, Women of SSTTE in Scarsdale, New York. If the following sounds familiar, you are definitely in the right place tonight. You're helping your teenager study for the SAT, coordinating your mother's next cardiology appointment, and trying to figure out whether your father's memory lapses are something to worry about all before 9 a.m. Or maybe you are helping your grown children by taking care of your grandchildren, picking them up from school, taking them to ballet or music classes, sports practice or games, maybe religious school, in addition to your own doctor's appointments, mahjong, canasta, bridge games, tennis, golf, or just lunch with friends. If any of this sounds familiar, you are likely part of what researchers call the sandwich generation. Wherever you are in the sandwich, tonight's program will provide you with helpful information. Our panel of four professionals will share guidance on caring for ourselves and our loved ones, navigating changing family needs, and finding support within our community. Please mute yourselves during the presentation. If you have questions for our panelists during the program, please put them in the chat box. We will try to answer as many questions as possible at the end of the presentation. We will begin with Connie Wasserman. Connie is a licensed clinical social worker and seasoned caregiver advocate with over 3 decades of experience strengthening the well-being of caregivers and their families. Her 23-year tenure at a prominent Long Island JCC included developing caregiver initiatives, leading support groups, and building community-based programs that address the evolving needs of aging adults and their loved ones. She went on to serve as a case manager for an elder law attorney, guiding caregivers through service coordination, benefits navigation, and long-term care planning. Connie has facilitated caregiver support groups across her entire career and has contributed her expertise as a board member and group facilitator for the Alzheimer's Association. As a former caregiver to both of her parents while raising young children, she brings a rare blend of clinical insight and lived experience. Connie's mission is to elevate caregiver support, reduce isolation, and empower families with knowledge and compassion. Connie, I turn the Zoom over to you.
Thank you so much, Beth. Thank you. And it's so nice to be here. Thank you for including me. So, I'm hoping that tonight's presentation will help caregivers, whether you're a caregiver currently or will become one in the future, understand how caregiving roles begin and evolve, identify practical legal, financial, and support planning steps, and recognizing the importance of protecting your own health and well-being throughout the caregiving journey. So, I'd like to begin with a brief relaxation breathing exercise to help all of you settle in and focus. This is a breathing exercise through the Mayo Clinic, and it's called a two-breath reset. Okay, so follow with me. It's going to be a few steps, okay? I'd like you to first relax, feet flat on the floor, and have your shoulders just relax. And I'd like you to take your first inhale, take a deep inhale breath, and I want you to put your hands on your stomach. And when you inhale, you should feel your stomach take in that air through your nose. And then I'd like you to release the air through your mouth. And you should be feeling your stomach go in as you release the air. And I'd like you to take another deep breath. And this is called a 2-minute reset. And this can be done anytime when that stress level is so great that you just need to relax for a moment. Can you show me through the chat with, like, raising your hand, how many of you here tonight are already caregivers? I'm not seeing anything, so I'm
I'm
not
not
sure if it's
seeing any electronic hands, but I'm seeing almost, or at least half of the folks who do have their cameras on. I'm seeing at least half of those hands.
okay. Okay. So, first of all, okay, I see a thumbs up. Someone said that they're a caregiver. So, what is the sandwich generation? Well, it refers to adults who are caring for aging parents while also supporting children or grandchildren. They could be young children. I know when I was a caregiver, my kids were ages 2 and 6, or they could be college aged children, or they could be grandchildren. And the caregiving role may also include empty nesters who are now caring for aging parents. And, the golden years of retirement have become a little bit more difficult and perhaps not what you planned for. So, how do your caregiving responsibilities begin? Very often, people tell me that they don't feel like they're a caregiver. Well, mom's in an assisted living, people are caring for her. I'm not really a caregiver. Well, you actually are. So, caregiving can begin suddenly after an unexpected illness or an event such as a stroke or an accident, or caregiving can develop gradually through changes related often to dementia. It can include memory loss, behavioral changes, cognitive changes. Dementia is an umbrella for different types of dementia. So they're subtle. They're not always, it's not like having a stroke. Suddenly there's an instant change. It changes over a period of time. And if you're an adult child that lives nearby, you may see these subtle changes sooner than those adult children that perhaps live on the other side of the country. And when you have a conversation with mom or dad, man, everything sounds okay. Hi, mom. How are you? I'm good. What's doing? Nothing. What's doing with you? Nothing. Okay. Have a good day. Everything's great. Talk to you later. That conversation doesn't give you insight into perhaps what might really be going on with mom or dad. So you may visit every 6 months and then see suddenly these great changes. So, where do you begin when you become a caregiver or you realize that mom and dad need extra help? Well, the first thing that's really important is to start by gathering and organizing important documents and getting information. Very often, we don't have those conversations with our parents. Our parents cared for us. If everything's okay, I don't want to know what I don't need to know until sometimes it's too late. So being able to understand where they are financially, if they have, important things in place already, these are important conversations to have. The sooner you have them, the better for all of you. It's important sometimes to meet with an elder law attorney and or a financial advisor so that you could review their legal and financial planning needs. Everyone is different. Do your parents have a healthcare proxy? Do they have a power of attorney? And is the power of attorney adequate? When dementia is the problem, you have a window of opportunity to have these documents created. Once a person is in the throes of Alzheimer's disease and are no longer recognizing people, it's rather difficult to be able to say that they have the capacity to put these documents in place. So the sooner you can have these conversations and have these documents put in place, the better you will be able to care for your parents. And what's really important for parents to understand is then you are not making decisions for them, but rather you'll be following what they want for themselves. It's important to ask for help early. You need to build a team of trusted professionals and personal supports. So you need to know who are the doctors, and you need to be able to speak with these doctors. Are there social workers? Is mom or dad in assisted living? Is there a social worker there? Is there a social worker in the doctor's office? When I speak about doctors, one of the things that's really important is, well, mom's been seeing this doctor for the last 20 years. Well, maybe that doctor was wonderful over the last 20 years. But the way we make sure our children see a pediatrician when they're children, a geriatrician can be really helpful for aging parents, especially if they're dealing with illnesses like a stroke or Parkinson's disease or dementia. The reason being, very often, doctors will say, well, what do you expect? They're older. Well, not an adequate answer. So being able to have them seen by a geriatrician can be very helpful to make sure they're getting the appropriate care for their age and whatever their circumstances. Family and friends. I often hear from caregivers, yeah, I really don't hear, my parents don't hear from their, friends any longer. It's really important for you to ask for help. We often think that we can do it ourselves, and we often expect or hope that people will come forward and just offer their help. But when there's an illness involved, people often think, I don't want to impose, I'm not sure, or people don't always understand and recognize what dementia might be if that is in fact what's occurring. Well, she hasn't called me in months. Well, sometimes with dementia, people forget to call, or they think they've called, or they'll say, haven't spoken to my daughter in months. Well, you just spoke to mom yesterday. So it's important for us as caregivers to seek help from friends and family. And you need to practice asking early on. It makes it easier so that they're part of this journey with you. Caregiving demands can become very overwhelming. So if you don't have a team in place, when things begin to get more difficult, it's harder to put those plans in place later on. So now what I'd like to talk about is when I facilitate caregiver support groups, everyone wants to come there and find out information like what's the best doctor or, what's the best depends to use for mom or what's the best medication. And I allow my caregiver support group to discuss those things for a short period of time. But then I like to focus on self-care because you're caring for your parent, but who's caring for you? Caregivers often focus so much on their loved ones' needs that their own health and well-being can become secondary. Over time, sustained caregiver stress can contribute to burnout and other health concerns. So your health and well-being is paramount. Caregiver burnout is a state of chronic physical, mental, and emotional stress that can affect overall well-being. Some research has found that caregivers experience prolonged emotional strain may face higher health risks, which makes early support and self-care especially important. So, number one, schedule and or keep an annual physical with your healthcare provider. Make sure you're taking care of your health. Pay attention to basic needs such as nutrition, sleep, hydration, and exercise. If you're eating fast food because you don't have time to take care of yourself, but you're making sure mom is eating, your health is going to be affected. Are you not sleeping? Speak to your doctor about that. Sleep is important to be able to give you the energy you need to keep up with the demands of caregiving. Notice the signs of ongoing stress, emotional exhaustion, anxiety, or depression, and seek support when needed. When we're a caregiver, we are also going through a grieving process. So, sadness and depression are part of that grieving process. There are caregiver support groups. Seek help. Other caregivers help you realize you're not alone in this journey, or individual therapy. Something that's important to recognize is, just because there are parents doesn't mean that we're thrilled about caring for them. Maybe there was a strained relationship prior to mom or dad getting ill, and now you have the responsibility of caring for them. Well, how do you work through that emotional piece, the resentment, perhaps the anger? Not everything is perfect. That's when it's time for you to seek therapy for you so that you could process and get through those feelings. Consider journaling so that you could track your physical and emotional changes throughout this journey. A gratitude journal can help you intentionally notice positive daily moments and shift your attention away from caregiver burdens. And it supports resilience over time. Studies have shown that it actually changes brain chemistry when we focus on what we're grateful for on a daily basis. It could be three things that you write down every day. Remember, caring for yourself is not selfish. It's essential to sustaining your caregiving role. Just as in an airline safety instruction, remind passengers to put on the oxygen mask first before you can care for your children. Caregivers are better able to support others when they're also protecting their own health. If anything happens to you, what happens to mom or dad? So, in closing, I would just like to say that caregiving becomes more manageable when families prepare early, organize key decisions, and build a reliable support system and protect your own health and well being. Thank you.
Thank you, Connie, so much. That was really helpful. We definitely need to take care of ourselves so we can take care of all of our other loved ones. Next will be Karen Catter. Karen Catter is a distinguished healthcare leader with more than 30 years of expertise in care management, in home care and long-term services. As an aging life care professional at Concierge Health New York, she specializes in helping families navigate the complexities of aging, providing expert care coordination and advocacy for older adults. She served as Chief Operating Officer at eFamily Care, a digital health startup focused on empowering family caregivers through innovative home-based care delivery. She led a national network of in-home care managers at Humana Incorporated, enabling chronically ill members to remain safely in their homes. Karen also developed Medicaid and Medicare health plans at VNS Health, Visiting Nurse Services, formerly VNSNY, implementing strategies to improve healthcare accessibility and home care quality. A dedicated advocate for the aging community, Karen serves as the co-lead for the AARP Westchester, New York division and is a member of the Northern Westchester Geriatric Committee. She is a professional member of the Aging Life Care Association and draws deep insight from her own personal journey as a family caregiver. Karen holds a Master of Public Administration in Health Policy and Management from New York University and a Bachelor of Arts in Psychology from Boston University. Karen, the Zoom is yours.
Thank you, Beth, for that introduction. And thank you, Connie, for your presentation on caregiving. I relate to it very well. So, hello, everybody. Tonight, I'm going to talk to you about how do I assemble a team to help take care of my loved one, or in essence, really, how do I make my life easier as a caregiver? What professionals can I lean on to help me navigate the journey of aging with my loved one? Next slide, Amanda. So I'd like to start with this quote from Rosalind Carter. Rosalind Carter was a huge advocate of family caregivers. And she said, caregiving is universal. There are only four kinds of people in the world: those who have been caregivers, those who are currently caregivers, those who will be caregivers, and those who will need a caregiver. And while I would agree that caregiving is universal, it can often be a very lonely, stressful, and isolating place. So, who do you turn to? Amanda, you can go to the next slide. Thanks. So, I'd like to introduce you to the Aging Life Care Professional, also known as a geriatric care manager. I may use these terms interchangeably. Um, as we all know, the healthcare system in America is very fragmented. Um, and what we do as aging life care professionals is we work with caregivers and their loved ones to really help connect the dots, to pull resources together, to make sure that your loved one is getting all the support that they need. We're often referred to as the quarterback. We are sometimes licensed nurses, social workers. I'm a certified senior advisor, but we all have backgrounds in working with older adults. And you may wonder, how do you pay for these services? Well, unfortunately, most of these services are out of pocket. Insurance does not cover this, but some Medicare Advantage plans, if your loved one's enrolled in a Medicare Advantage plan, have care management. And also, if your loved one has a long-term care policy, some long-term care policies include care management, and they also include family caregiving, in addition to paid caregivers. So if your loved one has a long-term care policy, I would encourage you to go back and read the fine print under covered benefits, because those two services may be included. And at the end of my presentation, I'm going to give you a link to the Aging Life Care Association. You can go in and look by zip code and find an aging life care professional in any, I think we're in every state plus Canada too, if there are some folks on the call tonight from Canada. Okay, next slide, Amanda. So, what are you dealing with as a caregiver? You may be trying to get your loved one's house ready for they're coming home from the hospital, and you're trying to coordinate, and you've got a million things going on, and you need to get equipment and supplies, and you don't know where to turn to, or you're worried about your parent falling in their house. You're going to multiple doctor's appointments and you're stressed about trying to find the time to go to a doctor's appointment and take care of everything else that you have on your plate. You're worried about your parent, you're thinking they can no longer stay in their home. Maybe it's time to move to an assisted living facility, or maybe you've been on a call with an insurance company for hours and not getting your issues resolved for your loved one. So an aging life care professional can really help kind of smooth out the bumps and provide the support to make your life easier and to address, these issues plus a whole host of other things that you may be dealing with as a caregiver. And next slide, Amanda. And I'm going to just give you three examples. Thanks. Three examples of what we do as aging life care professionals, sort of why go to an aging life care professional. First of all, I think many families with older siblings don't always necessarily agree, what's best for mom and dad. Mom and dad may not agree what's best for them. Sometimes there's conflict. And an aging life care professional can really be the voice of objectivity. And we can lay out different options. We can bring the family together. We can help make decisions and ultimately reach a consensus, or as close as a consensus as can be, so that the older adult is really, getting their wishes, and having their wishes heard and carried out. So that's one example. Another example is we do provide expert knowledge. There's a whole host of resources, which I'm going to get into in a minute, but there's so many resources out there for seniors in your community, but you may not know about all of them. And we have vetted references, and we also, if we don't know of a resource, we have networks that we can reach out to. And just to give you an example, I have a client who has dementia, and he was driving, and his son was pulling his hair out because we knew something bad was going to happen. And I was able to connect him to a driving evaluation test at a rehab facility. And he took the test. I guess fortunately, did not pass the test. It was no longer driving, but it really took a lot of stress off of the son. The son did not have to get involved. He didn't have to take his keys away. And it was a good resolution. So that's just one example of a referral that I would make. And then lastly, many families don't live near their loved ones. I have a client in New York City. His closest relative is in Israel. And I really act as the eyes and ears. I'm really like a professional daughter to this client, where I make sure that all of his medical needs are being handled. I make sure he has clothes to wear. And I am in very, very close contact with his brother in Israel. So his brother has peace of mind, the client has peace of mind, and it works very well because I'm able to really see him and see his apartment and see how well he's doing. So if you go to the next slide, please. But you do not always have to use an aging life care professional or a care manager, and it's not absolutely critical. And this slide, where I have the client and the family in the middle, and just as the quarterback, the care manager is around the client and the family. But if I'm going to just start and kind of walk you through these different circles that show different resources that you can draw upon when you feel the need or when it's advisable to do so. So first, starting with finances, many older people have financial advisors, but there's also a professional called a daily money manager, and you'll be hearing from Peter Gordon very soon. But daily money managers help pay the older person's bills. They can manage their checking, their savings account. They can help monitor fraud and abuse, which is a really big concerning issue right now for older people. And again, it really can take the onus off of the caregiver, and somebody else can really manage the day-to-day money. Next is legal. Connie mentioned, estate planning. It's very important to do ahead of time. You're going to hear from Michael LaMagna in a minute. But an elder care attorney is really someone that you want on your team. They can develop, wills and advance directives, trust if you're interested in protecting assets. It's critical, that you work with a lawyer and do it ahead of time. Planning is the key. Home care is huge. I would say, I think it's about at least 75%, if not up to 90% of older adults want to stay in their home as long as possible. And identifying a good home care agency and having a home health aide that you have a rapport, or home health aides that you have a rapport with, that you trust, can be really critical to keeping somebody in their home. And I work with home health aides on a daily basis. They're on the front line, and they're really close to can be really close to your loved ones, so they can really play a critical role in keeping them healthy and happy. The next is therapeutic and support groups. And just to piggyback on what Connie was saying about caregiver support groups, many associations like the Alzheimer's Association, Parkinson's Association, Heart Disease, they all have caregiver support groups. And these are virtual. They can be really helpful because you can connect with people who are going through the same thing that you're going through. And I mentioned, caregiving can be very isolating. It's a way that you can connect with others. And also, if your loved one needs a support group as well, all of these associations have support groups for the person that's, impacted as well. Um, Transitions and relocating. There are companies that work on helping an older person sell their home, and they can help with selling possessions. They can help with decluttering, and there are also specialists that can help with finding the right assisted living and independent living facility as well. I have a client. There are clients that are kosher, and they are going to be going to a kosher independent living facility. I worked with a specialist on that. So there are people that really know this industry well. And lastly, home and safety modifications. If your loved one wants to stay in their home, um, you can find a person that can put in wheelchair ramps, make your bathroom more wheelchair accessible, put in grab bars, and there's technology experts that can put in alarms, cameras, again, to make you feel that you can monitor. You don't have to run over to your parents' house. They're, right there, and you can see what's going on. Okay, next slide, please. Lastly, I'm going to just pivot quickly, just to talk about advanced directives. And it's an important conversation to have ahead of time so that you're not at a crisis at your loved one's end of life. End of life planning is just really important to have these discussions ahead of time so you know what your loved one's wishes are. For time's sake, I'm going to skip over the healthcare proxy and the durable power of attorney are really important, but I want to just talk very quickly about a document called the MOLST, or it's also a PULSE. Some states call it the PULST. And the MOLST is the Medical Order for Life-Sustaining Treatment. And this is a document that lays out a person's wishes, either an end of life or some life-altering event that you and your loved one know. Do you want to be treated? You might want comfort care instead of full-on interventions. Maybe you want antibiotics. It's a much more thought out document compared to a DNR. Um, and this document really should be posted on the refrigerator. Your loved one should take it if they go to the emergency room or to the hospital. It should be signed by a doctor. But I put in a link just so that you can see, just so you can look at an example. But if you go to your state's Department of Health website, you can find one. You can find one there. And I just wanted to add also, if you're having trouble bringing up end of life planning, because these are not easy discussions to have, you can go to a site called the Conversation Project, and it will guide you through how to start the conversation about end of life planning. And maybe you've started it, but you don't know how to close it. It can help with that as well. So it's a good resource to have. Next slide, please. And just to wrap up, this is a link to the Aging Life Care Association I said I would provide. You can also go to the Elder Care Locator, which is sponsored by the National Institute on Aging. And if you put your zip code in there, you get a display, a drop down of all different categories of services that you can query and look up in the zip code where your loved one resides. So that's it. You can reach me that's my email address, Karen Catter. I'm at Concierge Health. And I just also put in, this is our sister home care agency in New York called Silver Lining Care Solutions. So I will now turn it back to Beth. Thank you.
Thank you so much, Karen. There was so much helpful information. And people, if you do have questions, please put them in the chat box at the end We will try to answer as many questions as possible. So next, we are moving on to Peter Gordon. Peter is the president of New York Financial Organizers, Inc. He has been in business for 11 years. NYFO, New York Financial Organizers, has 80 clients. Peter is a partner with Jacob Gordon, and there are 5 part-time employees. He is a member of the American Association of Daily Money Managers. He is a certified daily money manager. I'm not giving you all the letters that go with all of these things, and is a past president of the Greater New York chapter of the AADMM. As a member of the Association of Daily Money Managers, Peter is required to pass a background check and is guided by the organization's code of ethics. Peter is a member of the Orion Resource Group, is a past co-leader of its Manhattan chapter, and has taken courses in geriatric care management at the Brookdale Center for Healthy Aging. He earned his MBA in finance from Baruch College and a BA in political science from the University of Buffalo. Peter, it's your turn.
Thank you, Beth. I appreciate it. And we've heard a lot of information so far, and now we're going to hear even more. I love the spiritual nature of Connie's presentation. And I work with Karen with different clients, and care managers are wonderful. And they actually changed my life. And if we could go to the next slide. What I'm going to talk about is what a daily money manager is, how I became a daily money manager, why I'm one, how we promote wellness, and then tracking income and expenses, and spend a little time on how you could calculate how long your money will last. Next, please. So daily money manager is something of a misnomer. A money manager is generally a financial advisor, somebody who invests your money. But daily money managers, while we deal with money, we are only involved in the non-investment side of personal finance. We work mainly with seniors and adults. I would say in our business, 80% of our clients are seniors. But we also work with people with disabilities, could have special need trusts, and more and more busy professionals are working with us as well. They're trying to track their money and figure out where it's going and where they're spending it. And the same with high net worth individuals. And next, please. So what we do is we help people pay their bills, file insurance claims, create budgets. And as I said, it's all the non-investment side of personal finance. And we also act as a personal fiduciary. That means a power of attorney, executor, or trustee. More and more people are coming solo agers, and a lot of attorneys reach out to us for those services. But we also are dealing with the sandwich generation, because sometimes they don't have anybody they trust, and they need a backup power of attorney, a backup executor, or possibly a trustee. And we're happy to serve that role. You could go next, please. So why am I a daily money manager? This is my third and final career. I'm where I belong, which is wonderful. I love what I do. It's yeah, I make a living, but we help people. We make a real difference in our clients' lives, along with the people we work with, the other members of the senior service industries. In my, I would say, ridiculously long bio that was read, it mentioned the Orion Resource Group, and that's a group of people who are in the service senior industries. And you'll, already, I know Karen referred to them, and it's, so we love talking to other people about maybe it's their money issues, but we also know the other experts, and we're happy to refer them. And I've met them through the Orion Resource Group. And that's also where I met a geriatric care manager. So about 20 years ago, my father became ill and we didn't know what to do and how to deal with it. This is when I was very much a part of the sandwich generation. I was very fortunate. My brother and my sister and I were all involved with our parents, excuse me, and we got along great. But when my father became ill, we did not know what to do and where to turn. And through an artist, actually, so that I was networking with, she introduced me to care managers. And it really changed. It changed our lives as a family and eventually changed my life, because that's what introduced me to the senior service industries. I started my business in January 2015. My mother at that time was in community Medicaid. That's a whole nother presentation. I don't know if Michael will touch on that at all, but it's a great service that you can have in New York. And we could touch on that at a later date. So over time, about 8 years ago, I was getting really busy and I needed help. And my son, who was out of school for a few years, Jacob, started working with me part-time. And today we're partners. It wasn't the plan. And I think that's why it's working out so well. And we are able to act as consistency with our services. So if one of us is a fiduciary, usually the other person as well. So there is a succession in place if necessary. We had a client who she was she lived to 103, but when she was 99, she she needed a backup, and Jacob became her backup. And she said, "Oh, I'm so thrilled because this is in case your father dies before I do." And in all seriousness, it is actually very important. So I really do love what I do. And part of that is promoting wellness. And if you could hit the next slide. So I referred to this previously. We work in teams. We're just daily money managers, but I'm familiar with the care managers and home health care agencies, doctors, obviously family members are part of the team, accountants and financial advisors. They're all necessary, but in different combinations. Every client is unique. And the most important thing that can happen with the care team to help promote the wellness is to communicate. So we work with other like-minded professionals in providing the necessary services. If you could go to the next slide, you'll see like a sample case where very often, and when it's a sandwich generation, and the family member is generally the one running the show. And, this is possibility of who could be involved. Doesn't mean anything, but it can switch at any time. But that care, I call it like we're a spoke in the wheel of care. And my partner says it's the circle of care. But if you go to the next slide, you'll see a different setup where, okay, the care manager is the center, and a lot of times we're brought in by care managers because they could see that there are money issues going on. They go in there and they go into the home and they see that the bills are piling up. The mail is not answered, or there's this unfortunately is not unusual. There's a fraudulent transaction, and so they're off in the center. But it could be anything. It could really be any person. The important thing is the communication. Next slide, please. So the backbone of our work is tracking the income and expenses of our clients. We get access to our clients' checking accounts and credit card accounts, and then we download that information into Quicken. It's not rocket science, but it's time consuming, and over time it works out pretty well, and it gets faster, but we categorize every single transaction so we know exactly where money is going and where it came from. And then we prepare and review the monthly income and expense reports. And those are great because if we do that on a monthly basis, come January, when it's time to get all the tax reports, tax reporting done, we have a big jump on it. And so our clients can start talking to their accountants, in February. Another reason why it's very, very helpful is that most medical expenses, if they're being paid for on the books, and if people are paying, and the aides are paying taxes, they're tax deductible. So not everybody knows that, and I've had cases where we've met a client and we take a look at their past tax returns, and they haven't written off the literally $100,000 of home health care costs. So that's a real benefit. And then we'll also provide financial snapshots. So we don't invest the money, but we know how much people have. We know what their expenses are, and that gives us a good snapshot. So if you could go to the next slide. This is kind of a sample from a client that we had, and it's pretty detailed, and this is actually cut down, but we could see the income was 98,000, and if we look at the expenses, the total expenses were 224,000. And I'd like to say this is an extreme case. Not all our clients are like this, but it's not unusual. But a lot of clients also have long-term care insurance. They're having trouble filing that. We're able to help them do that. So it really goes a long way. In this case, the long-term care, there was a credit of 22,000. It all depends on the policy. But it also allows us to see exactly where the money is going. If you go to the next slide, you'll see a breakdown of that medical expenses I was talking about. So we break it down to the actual different aid there was, and then the assisted living, and all this 209,000, that's tax deductible. And that's offers a huge tax savings, because very often the income, like this person had a significant income but needed more, so the other money was being made up by selling securities and their tax implications, and so the medical expenses really go a long way to offsetting that. That is the short of it, not the long of it. I want to stress that it's not just numbers. I brought that up a lot in here, but I have a competitor who has a wonderful tagline, and it's life keeping, not bookkeeping. And so Friday night, I got a call from a client's aide, and actually Karen's company is the care manager, and they had delivered. They were supposed to get a nebulizer. They got the medication, but they didn't get the nebulizer. And this client is by himself. He has one relative who's his grandson, who's wonderful, but he's not around. And so I went out Friday night, and uh, we got him a nebulizer, and he slept well, and that's the way we work, and that's how our focus is. And I could guarantee that Connie, Karen, and Michael, who you'll hear next, and all have that same attitude. And listen carefully to what Michael has to say. It's so critical to have those advanced directives that Karen talked about. You really need them in place. And thank you for your time.
Thank you, Peter. That was a lot of information, but all very helpful, very necessary for sure. Last but by no means least is Mike LaMagna. Mike LaMagna brings over 15 years of estate planning, probate, health, and elder care litigation expertise to LaMagna McKenna, PLLC. As an experienced litigator, Michael has been representing individual clients and healthcare facilities alike in all manners of healthcare-related legal issues, including complex estate actions. His licensure and industry experience as a nursing home administrator inform his unique ability to represent his clients in the ever-changing world of health and elder care law. Michael has sensitively and successfully represented clients in matters including trusts and estates litigation, guardianship, conservatorship litigation, special needs, elder law, elder care, um, elder care law, probate administration, and associated litigation, nursing home and assisted living, long-term care, insurance matters, etc., etc. As a former adjunct professor at Long Island University, Michael has taught both long-term care administration and healthcare courses, educating scores of long-term care administrators. Mike, you're the last, but by no means the least. Go for it.
Well, thank you very much. And so what I want to say is, to all the caregivers out there, really thank you. And how difficult and unpredictable it is. Right during this presentation, I got a call from the hospital about somebody who I'm the power of attorney and healthcare proxy of, and I had to navigate them going to the hospital. So it's really the unpredictability of your day when you're a caregiver. And I'm sandwiched. I have kids in high school, I have aging parents, I have a friend that I'm responsible for. So, I understand, and I wanted to say that I just appreciate you and everyone that's a caregiver. I know how hard it is, and I think that you're all just great for doing it. So there's a common theme through tonight. Number one, we all work together. You never realize how hard it is to really navigate somebody and how difficult their life is until you're stepping in the shoes and you're forming a community around somebody. And secondly, how important it is to plan ahead, because everything that we're going to talk about, everything everybody has talked about tonight so eloquently has to do with, having a little bit of forethought. And with a little bit of planning, and this doesn't take a lot of money. I've seen some of the chat things like, oh, money, and not everybody has assets, and that's very true. Not everybody does have assets, but everybody can spend the time to get some basic things done to prepare for their own future. So that's really the common theme that I am threading through this presentation, even unprompted. Next, please. And as far as planning goes, there's things that we plan for. There are happy events. This isn't really something that people want to plan for. Their death and capacity, what's going to happen when they get older, their burial. And I understand that. It's not pleasant for me either to think about it, but you want to think about it before someone has to make the decision for you, because this is all about you. It's the one time you really get to be selfish, and it's okay, because one day you may not be able to make a decision, and it may not be in 30, 40, 50 years. I actually had a client recently whose aunt and uncle got into a plane crash together. So you just don't know what's going to happen in life. So we all think we're going to live forever, and hopefully we will, but it's important to realize that one day you may get sick and you probably pass away at some point. So, what are we talking about next? That, the statistics are that 70% of us, that's 7 out of 10 of us, will need some long-term care services at some point. I actually think it's a lot more because a lot of the services that people get are through family and friends, and that's not really counted. But 70% is the statistic, and 25% of adults over 65 have no children or spouse to help with their care. That doesn't mean that they don't have children, but some people don't have great children. Some people's children live far away. In this area where we're qualified. I know people are coming from all over the country, which is wonderful, but we're centralized on, basically in New York City area, and there's a lot of people that don't have support systems, and it's really important that we realize that, and there's some special planning for those people too. And the sandwich generation, like I said, it's caring for children, caring for adults, not caring for yourself so much, and it's really planning for the future. Next. So, one of the things I tell my clients is, when, what to look out for, and when they're visiting with their parents, and I know Karen did a great job of talking about some of this, but, you want to pay attention. You know, Somebody very close in my life, I'm looking at the car and I'm seeing all the dings in the car and I'm going, he's not driving so well anymore, is he? He just had cataract surgery. It's more cognitive than physical, I think. You want to look at the car, you want to look in the refrigerator. You want to look at the phone bills because sometimes they're making strange calls or people are calling them and they're exploiting them. You're looking at unexplained bruising and burns and things like that, and hot water burns. So it's important, as that you pay attention if we have people that are children of seniors, that they're really paying attention to some of these signs when they're visiting. Next, please. So the roadmap. Um, so how do we do this? How does this happen? And so it really starts with the planning part and with the conversation. And it's funny, like all of us parents, we think the conversation is talking about our kids with the birds and the bees. The conversation in the senior services world is mom and dad, you're getting older and you need to plan. Or mom and dad, maybe you can't live in the house anymore the way that you want to live in the house. Maybe you need a caregiver to come in. Maybe you need help driving. Maybe, so the talk is something that is very important to have because sometimes people don't see the issues in their own life, but their children, when they're coming for Thanksgiving or Christmas or Hanukkah or whenever, even 4th of July, which is coming up very soon, you know, they're going to notice some things. And that's, you want to have the conversation. And a lot of times you want to have it with a professional, like an aging life care manager or care manager, if you need resources, or call the elder lawyer and say, how do I talk to mom and dad about this stuff? But it starts with a conversation. And it doesn't have to be, look, we're taking away the car from you tomorrow. It really can be, I'm noticing some things, or how are you getting along? Or is dad sleeping at night? Is he up all night? Is he forgetful? It starts really there. And then from there, we move to the next phase. Next, please. Actually, next slide. And one other. So, most people think, well, I don't want to go to a nursing home. That's like the first thing anyone ever says. And I'm a nursing home administrator, and I feel that way too. But you know, it's being in the right care, and the right level of care. And I'm a firm believer that, there's different levels of care. You have independent, assisted, memory care, continuing care, retirement communities, skilled nursing, and the point is to try to be in the right level of care, not too much care. My own mother went into senior housing way too young. And I think that was one of the reasons why she wasn't so successful in senior housing, because she was 62 and well when she decided to go in. You know, I think that, being put in the right level of care at the right time will probably prevent you from having to skip over a level of care because you've fallen or haven't had enough supervision. etc. So, most people think, look, I don't want to go to a nursing home, but there's so many different levels of care. And the important thing is to think about the right level of care at the right time according to your needs. Next, please. So there's lots of factors to consider when we're doing long-term care planning. We start out with, what are your goals? What are you trying to do? Some people say, look, I want to live in this house. By the way, it's my backyard, and I probably want to live in this house as long as I can. But most people say that, I want to live at home. Okay, I want to live at home. Well, how are you going to afford to live at home if you need care, and how much care might you need? Um, some people are like, I want to go to an assisted living. Okay, how can we utilize your income? So, because assets, I describe long-term care costs as a faucet, and assets go very quickly, but income is steady. And people have pensions, people have Social Security, people have required minimum distributions from the IRAs. So we look at all the assets, and we look at the income, and we look at the care, and we look at your goals, and we then figure out, you know, with you, where is it that you want to live now? You might want to live in 5 years. You might want to live in 10 years. You want to move in with one of your kids? That's okay. That's fine. But we're going to need to modify the house, and we're going to get the money to do that. You're going to sell your house and then modify your kid's house. And then how does your estate balance that if that's something that's important to you? A lot of people say, well, if I'm giving my kid 200,000 to upgrade their home so I can live in it, well, then how do I equalize that amongst my other kids? And some people feel like, well, I'm going to live in that house and I don't want to equalize it. But it's each, as Peter said, it's individualized for each person and what they're trying to do now and what they're trying to accomplish later. Okay. Skip. And skip one more time. Okay. So we can get to meat and potatoes here. Everybody tonight has mentioned the basic estate planning documents, and I'm going to run through them. But we're starting with the power of attorney. Power of attorney is the most important document, and that's why we start there. It's financial, and it says that this is the person that I'm going to trust to make decisions with me, and potentially one day, if I'm incapacitated, for me. So you can imagine, very important. And I always say, let's explore the people in your life that you're going to give power of attorney to. Just last week, I said, tell me about your son that you say you want to give power of attorney. He's divorced. He's a gambler. He doesn't have a job. And I'm like, well, that's not a good person to manage your money, don't you think? And, so we look at the people that you're appointing. It's not just, here's my document. It's who are they? And are they going to work in your best interest at a time when potentially you don't have the ability to speak for yourself? Then a healthcare proxy. It's designating an agent to make healthcare decisions for you when you cannot. A very important document. The living will. The living will tells your healthcare agent what you want or don't want at end of life. Meaning, if you're in a terminal situation with no discernible brain function, would you want to be kept alive by extraordinary measures or not? Do you want hospice care? Do you want palliative care? Do you want your kids to agree with the long-term care, with your living will and the plan when you're going to pass away? What's going to happen to you? Your disposition of remains. So all those things become important, and you can make the decisions now, because the last thing most parents want is for their kids to have to make the decision. You're making it now. They're just carrying it out. So it takes the burden off of them. And then the last will and testament governs when you pass away, and it's your assets and where they go and who's in charge, the executor. What's important about the power of attorney, healthcare proxy, and living will is they operate while you're alive, right? Everyone's so fixated on their will, but the will's only after you die. I'm more concerned about what happens when you're alive and potentially incapacitated. In New York and in Connecticut, there's conservatorships and guardianships. If you don't have adequate powers of attorney and healthcare proxy and living wills, then the courts decide. And last week, I'm coming out with an article, and if you guys supply us with your information, I'll make sure you get the article. Just last week, I had a conservatorship in Connecticut where the state lodged the conservatorship, and this couple, married 58 years, they try to take the ability of the wife to make decisions for the husband. And it was absolutely terrible. And it's because he didn't have power of attorney, healthcare proxy, and living will appointing his wife. And we won. We were able to ward off the state, but it was pretty costly and terrible for the family and could have been avoided. Will, like I said, is after you pass away. Now, most people get very nervous with trusts. And, briefly, trusts come in two different types. One is a revocable trust, and this is just my IST, but I like to show everyone, what a trust is. A trust is just a container. You're forming a legal container. You're putting assets in to the trust. This is a revocable trust. What this means is you put the assets in the trust. You see how it's open? It's available to you. So what a revocable trust is good for a couple of things. First is during your lifetime. If you become incapacitated, the next person that you appoint as trustee can use the assets in the trust to pay for your long-term care costs, your bills, etc. Secondly, as Peter mentioned, there's a lot of fraud and abuse going on, especially elder fraud and abuse. So a revocable trust wards off a lot of that elder abuse. It becomes very important because most people can't penetrate the trust, and there's safeguards in the trust for it. Most people realize that a trust distributes immediately after you pass away to whoever your beneficiaries are. So you don't go through the courts, you don't go through probate. It just distributes as you state in your trust. They're very useful, and they're very good, especially to ward off abuse. Now, an irrevocable trust is a little different. It looks like the revocable trust, but it has a lid on it. So the lid here prevents you from accessing the assets that you put in the trust. So why would you ever do that? Well, most of it's Medicaid planning or Title 19 in certain states. So when you put an asset in an irrevocable trust, you no longer have the ability to access that asset, but neither does Medicaid. So in different states, there's different rules. In New York, there's something called community Medicaid, which Peter mentioned, which if you put an asset in the trust immediately, it doesn't count, and you could access home care benefits in New York. Different in Connecticut, different states. But most states, if you put an asset in the irrevocable trust after 5 years, if you go into a nursing home, they can't count that asset, and that saves it for future generations. So trusts are very, very useful and very important in a lot of the work that we all do. Next slide. So most people don't realize when you don't have a will and you have assets that you own solely, the state already determines where the assets are going to go. And this is what's interesting. Different states have different rules. Like in New York, the spouse gets 50,000 and the children share in 50,000. The children share in the other 50%. So the spouse gets 50,000 plus half the estate, and then the rest goes to 50% to the children equally. So without a will, and if you don't have a trust, the state's going to determine where the asset's going to go, but most importantly, they may not go where you want them to go.
Mike, can you wrap it up, please?
You betcha.
Thank
So
you.
if you go two slides ahead, keep going. Keep going. One more. Okay, last slide. And I'm wrapping it up, I promise. So whatever attorney that you go to, whatever care manager you go to, whatever daily money manager you go to, whatever social worker you go to, make sure that the plan that you put in place represents you. Too often, people come to me after they go to some other people and they say, you know what, this is what the attorney wanted. This is what the care. No, the whole point of this is for you to be selfish and for you to actually come up with a plan that you want, because this is going to be your long-term care plan for 5, 10, 15, 20, 50 years. And it needs to reflect who you are, and the documents need to reflect what you want. And it's important that it become your plan. Thank you very much.
Thank you, Mike. I want to thank all of you, all of our panelists. You had such great information for everyone. There is a question that was asked earlier, and panelists, just tell me, raise your hand, which one wants to answer this? Are there resources to help pay for the professionals that you may need to help your loved ones? Just Mike, Peter, Karen, Connie, who would like to? Connie, unmute. You're still muted.
I'm still on mute.
There you go.
Okay. Um, and I think that Michael alluded to this. It depends on the state that you live in. So in New York, there's community Medicaid. So if you want to be able to pay for home care, community Medicaid can be helpful. And that is really why you want to make sure that you plan ahead with an elder law attorney so that way you have things in place. But again, it depends on the state that you live in.
Anyone else want to join in on that answer? Peter?
Oh,
So there are other things. So if you're a veteran or your family member is a veteran, there are a lot of benefits there. If you're a retired New York City teacher, I can't speak outside of that. There are a lot of long-term care benefits depending on if you got the catastrophic care. And so those are two more that I could come up with.
Thank you.
also, sorry, Beth, just I would add too that many of these associations, like the Alzheimer's Association, or I know in New York there's an association for it's called Caring Kind for people with dementia. They have lots of resources that are for free, so they are do a good job at connecting people.
Mike?
Check your long-term care insurance policy if you have one, because a
Yeah.
lot of times there are benefits for care management or durable medical equipment that most people don't realize that's where we check first.
Great. Thank you.
I'd
Anyone?
also,
Peter?
so Sharon Nickerman writes in the chat that long-term care insurance often pays for care management services. And I had something else and it escaped me. I'll put it in the chat when it comes
Okay.
back.
Does anyone else have any questions they would like to ask our experts? Okay, I don't see anyone. Faith, do you see anyone? I don't see any other
I
questions.
haven't seen any additional questions.
Okay, so Faith, I can put it over to you.
Thanks, Beth. Hi, I'm Faith Alexander, WRJ Vice President of Programs. I want to extend our heartfelt thanks to Beth Quinn for coordinating and facilitating our program tonight, and to our speakers, Connie, Karen, Peter, and Mike, for sharing their time, expertise, and personal insights on the complexities of the sandwich generation. Your perspective have deepened our understanding and given us meaningful tools to navigate these responsibilities with greater compassion and resilience. We are also grateful to everyone who joined us tonight. Your engagement and presence are what make conversations like these so impactful. Special shout out to our WRJ staff partner, Amanda Feldman and Nikki Braun, for running our tech and making this program possible. If you enjoyed tonight's program, please consider adding these upcoming WRJ programs to your calendar. July 1st at 8 p.m. Eastern, Reading the New Colossus, a conversation with Faith 250. September 3rd at 12 p.m. Eastern, a virtual tour of Israel with Shari Robbins. October 19th at 7:30 p.m. Eastern Time, Simeon Solomon Watercolor Art. And last but not least, December 9th and 10th, the Freed Women's Summit in Philadelphia. We hope to see many of you there. You can find more information about these events in the post-program email you will receive in the coming days, or on the WRJ website and in the online programming group and Mighty Networks. Thank you for being here, and see you in the next one.
Thank you, everyone. You were terrific. It was great. And now I have another meeting to get to.